The most important part about a health service is who is delivering it. It is the health workforce. Therefore, we have to take care of them and equip them with the required skills to provide the services in a dexterous way, so as to be able to interfere and save human lives. The training workshop has been about learning and teaching. It is one of the programs of the Carter Center for Public Health Training. It is implemented through the Academy of Health Sciences and Continuous Professional Development Center. We target the instructors at the Academies of Health Sciences from the states and the midwifery schools, in addition to the instructors of the Continuous Professional Development Centers in the 8 SPHTI targeted states where the Carter Center works.
Previously, we have implemented 13 workshops in learning and teaching, accompanied by an assessment to measure the trainees' capacities. The assessment had enabled us to choose 20 trainees to participate as trainers in the advanced training of the learning and teaching courses.
ثاني اكسيد الكربون معناتها ده غير الايمن لو عايشين عن طريق.
Our working staff has received the learning and teaching training course. They have benefited of this, and the communication between the instructor and the students has become very easy.
We have a critical need for this type of training in the northern state. Therefore, we had participated by 30 instructors in the learning and teaching courses. They are trainers at the Academy of Health Sciences and the Continuous Professional Development Center. They benefited from those training sessions, and their performance in relation to the formulation of educational goals has improved, as well as in roles playing, students assessment, exams preparing, and seminars as a type of assessment. The training has added a lot to me. We have acquired the training skills in conformity with the applied protocol, such as setting up the objectives and preparing the training and sessions plan.
Any person who is working in the field of training should receive this training because it involves many essential skills which have remarkably changed our concepts. We have been delivering several types of trainings for the cadres in the different health institutions. However, such training has never been delivered professionally in the way which we had learned in this training. We have discovered that everything should be implemented in conformity to specific standards and prior assessments. For instance, to present a course properly, we were acquainted with Gagne's 9 steps. It is the first time for me to hear of Gagne's 9 steps. This has pleased me and has increased my confidence. I feel that everything will be changed for me after this training. We became familiar with the computer and communication skills.
I am teaching at the academy. In the future, I will employ the advanced systems which we have learned during the 10 days. I have colleagues at the academy. I will share this information with them to change their performance towards the students. For me, as a director, there has been a part in the course related to supervision. Far away from teaching, this part will help me in the process of management to promote the performance at the academy branch in Hasahesa.
We were presenting many things that have never been delivered according to these steps. Even for the exams, we have never compiled and implemented it in accordance with the methods and standards which we have learned here. Also, the assessment of the exam itself and its consequences for the academy.
Furthermore, we have acquired the skill of assessing the training we have delivered, how to measure the progress achieved by the students, and identify where the improvement in the training program is required. I hope that all the other colleagues will join this course because of its great benefit, and the way the training was delivered was amazing. And the methods of delivering the information is better than the conventional methods using the blackboard and chalk. We have noticed that the comprehension of the students is much higher than in the old methods. One of the benefits which we have received is the interactive training. We have presented practical lectures during the training. However, we need more courses, particularly in the area of the modern education tools.
At the course of learning and teaching held in Khartoum, we have learned the principles of adult teaching and how to deal with them. In addition, I have got the benefit of knowing how to select the suitable method and proper means of delivering the sessions in accordance with the subject matter. We have left the blackboard method to teach through the projector and through seminars and work groups. At the moment, we are implementing these methods at the midwifery school here. Earlier, most of the midwives were illiterate. At the present time, they are literate. So, most of the things we have learned are of great benefit to us, and it is applied at the School of Midwives. For instance, in terms of communicating and dealing with the student, earlier we have been scolding the students and driving them out of the classroom. At the present time, we have got rid of all these methods and adopted the new ones.
For the course of learning and teaching, we used to select 2 persons of the teaching staff to travel to Khartoum to receive the training. We hope that these courses will be held at the state-level academies so as to enable great number of trainees to participate and maximize the benefit and impact.
Since I have come from a remote state and the duration of the workshop is 10 days, I preferred that the course would have been held in my state. It is true that we have got the benefit of the course, but we have been exhausted because the Khartoum state is too big with difficulty in transportation means.
I believe that when the training is held in the capital, the benefit will be greater because the trainees coming from far states will encounter other trainees from different parts of the country and will be acquainted with different cultures and new ideas. Some trainees have accumulated experiences to be exchanged during the course. Consequently, I think the sessions which are held in Khartoum provide me with more knowledge than those which are held at state level. The Carter Center is one of the few organizations that provides us with the training of human cadres. So we are looking forward to increase the level of training from the refreshment level to the basic training level, namely for the cadres with few numbers, such as the anesthesia technicians and the operations theater attendants. We are in need of more high-value training courses, such as the courses of educational psychology to assist us in dealing with the students, and the courses of SPSS, which are very important because the development of systems in the countries rely on the studies and analysis that are derived by the accurate statistic figures. We are in need of such courses to promote the capacities and skills of those working in the field of health.
I hope that the project will grow horizontally and vertically at the same time. Grow up vertically in terms of modernization and horizontally to cover all the states of the country.
We have felt that this is a real human resource development for us. We hope that it will be extended to the other states. We knew about the Carter Center and its activities in Sudan. The assessment of the learning and teaching course is still in progress. If the outcome has been proper, that would have given a drive to the SPHTI initiative. We hope that the initiative will expand to cover all the states of the country, even if only in the field of learning and teaching.